Very much. And thank you so much for inviting me to make this keynote speech. It's very humbling to be asked to address this important conference. So I work at Greater Manchester Hazard Centre, which is an occupational health and safety organisation, providing free advice to workers on all things health and safety and welfare related. We're a not-for-profit organisation. We're not a charity because we unashamedly campaign politically to hold governments to account. We're not aligned to any political party. I'm also proud to chair the Hazards campaign, which Greater Manchester Hazard Centre is part of. We have spent the pandemic providing advice, training, support, and campaigned on all aspects of COVID, working alongside other organisations, as Joan said, including the ones involved in organising this fantastic weekend's event, and including trade unions to keep people safe and healthy at work. We knew before, and it was proved during the pandemic, that workers' health is public health. If someone gets sick at work, they take it back into their community. And we've tried to hold the government, employers, and the health and safety enforcement authorities to account on this. When the World Health Organization declared COVID-19 a pandemic on the 11th of March 2020, on the 19th of March, just a few days later, the UK declared COVID was no longer classified as a disease of high consequence. And by April the 11th, 19 health workers were dead. This was a significant decision. We've been hearing from some of those people who made this shameful, deadly decision in the public inquiry. Through the pandemic, we've issued press releases, written letters to HSC and MPs, held online information meetings, safety reps meetings, and the online and written record provides a harrowing account of the despair and catastrophic conditions that people have experienced and worked in. When the government finally decided to lock down in March 2020, we immediately went online to offer support and advice to all workers, but especially all those continuing to work in the crisis. We have tried to keep up with the ever-increasing changes to the guidance, change to meet the ever-dwindling PPE supplies and inadequate resources and preparedness by our previous governments. Like many, we've been angry and frustrated for most of the last few years, for the workers and all others whose health and safety have been put at life-threatening risk. We've also supported bereaved families of those workers who've died and those left with long-term disabilities as a result of infections, and also supported workers placed at increased risk because of their health conditions, existing health conditions, or those facing systemic inequalities. Health and safety management is based on the premise of a preventative and proactive control of risks. Health and safety law should have kept most workers safe, even during the pandemic. The hierarchy of controls and regulation requires employers to identify the hazards before they cause harm and then put in place control measures to prevent any potential harm. And our anger and frustration came when we knew that the government weren't following a precautionary principle, when employers didn't provide the preventative approach, and when the enforcement authorities didn't ensure that health and safety law was followed. Health and safety legislation doesn't just cover factories and offices, but schools, hospitals, public buildings, restaurants, cafes, pubs, fun fairs, etc., etc. All our spaces are covered by health and safety legislation, and exposure to infectious diseases are a known hazard, and therefore the protections, the control, the hierarchy of controls needed to prevent their transmission are also known. Early on, when the debate was how was COVID-19 spread, to us, the speculation didn't matter because we expected the highest protections until the transmission routes were identified, not based on a guess or on what PPE or resources were available, but on hard scientific evidence. That precautionary approach, which we saw early on in China, full protection to cover all eventualities. We've had plenty of damning evidence at the public inquiry, but I have to say, in the Hazards campaign, we are very sceptical of these inquiries. The people that we represent whose family members have been killed at work tell us the worst words that they ever hear is lessons learnt, because they know that means lessons are learnt until the next time, and they rarely get any justice for the deaths of their loved ones. Those government ministers, those so-called professional advisors, those public health and safety professionals who we believe are culpable for the deaths of hundreds of thousands of people, many of the deaths which could and should have been prevented. They'll never be prosecuted or held to account, and in the eyes of the people traumatized, bereaved, and us all, no matter how many times they say we didn't know, they'll never be forgiven because they did know, they do know, and they're still denying it today. We will never forgive the Partygate, the empty and fraudulent PPE contracts, the vanishing data, the lack of investigations, the lies around transmission routes, the bullying of workers back into workplaces, the lack of ventilation and air filtration for ordinary workers and school children and students, the reduction of PPE standards, the sacking of health and safety reps and the blacklisting of those same reps, where employers fail to control the risks, the release of COVID-infected elderly back into care homes, the lack of sick pay for precarious workers, and the dismissal of workers who develop long COVID because of repeated infections at work, to name but a few. We heard this week at the public inquiry from Professor Kevin Fong, an ICU clinician and academic who had a senior role in the NHS early in the pandemic. He visited ICU units in hospitals during the first 18 months of the pandemic, providing a lifeline to many of the ICU staff facing unprecedented levels of death, 70% or more of patients dying in some hospitals in their ICU units. And his testimony was heartbreaking. He said that COVID was like a daily terror attack. He said it was like a scene from hell. There were literally no one to give staff even a toilet break. The trauma has left many broken and unable to work because of that experience. We held our own workers' inquiry to place on public record the experience of workers who will never be heard or their accounts recorded anywhere. The trauma of railway workers who, with underlying health conditions, were forced by managers to go onto a platform, exposed to someone purposely coughing on them because they were black, from a black and ethnic minority background, and then catching COVID and dying within days. Or the college lecturer trying to protect her family members by isolating only to be exposed at work because her employer saw fit to ignore the risk controls because he knew better. Or the care workers and health workers living away from families in tents or exposed because a precaution level of PPE wasn't available to them, and their management insisting that it was safe for them to wear plastic aprons and wash their hands to prevent an airborne infection. Or the school, or in the school, teachers and children crammed into unventilated classrooms with the ridiculous notion that children weren't infectious. The ludicrous policies of bubbles in schools which left them exposed to hundreds of others because their school chose to ignore the risks. And the people who should have been challenged in some of these devastating actions, who should have been investigating them, the health and safety executive, they failed absolutely to bring health and safety law to bear. At a time when we thought they would be considering who was the most at risk and prioritising those workplaces for inspections, they backed off. There has not been a single prosecution of any employer for failing to ensure that COVID infections were controlled. Not one. In summing up the decision of the jury of the Hazards Campaign Workers Inquiry, the lead juror said, our judgment is that we have witnessed social murder, social injury, social illness, both physical and mental, and we demand legal proceedings against the corporate bodies, the senior individuals, and we demand truth, justice, and accountability. The catalogue of errors, the lies, the misrepresentation, the greed, the fraud, etc., didn't stop, hasn't stopped. With wave after wave of COVID bludgeoning us, so too did the corruption of an inept government. They consolidated the disaster with crude policies like eat out to help out in their pursuit of Brexit at all costs. But we shouldn't forget that some countries attempted to get it right. New Zealand were an exemplary model of a cooperation between politicians, industry, trade unions, and health and essential services. They put people's lives before profit. They challenged the neoliberal, corrupt global position, and it resulted in minimal infections. And 4 years on, what have we learnt? We know that the pandemic didn't cause our occupational health problems, it exposed it. We've been breathing a toxic soup of air pollutions, viruses, and other airborne hazards in inside spaces for decades. They went right before COVID and they still aren't right. COVID should have been the key to improving the air we breathe, but instead neoliberal dogma has prioritised the rich get richer and the poor get sick. We know health workers, care workers, and essential workers were heroic, and their contribution should never be forgotten. Trade union reps, where they were able, were also heroic, preventing infections and resisting unacceptable conditions that put people at risk. But that didn't happen by accident. This conference illustrates graphically how important it is to come together to unite against this ongoing risk to health. As the Hazards magazine eloquently coined the phrase, no one is coming to save us. Our salvation is ourselves. We need to push for clean air in all inside spaces. It's good for health and it's good to eradicate all airborne risks. We need to ensure infection controls include PPE if necessary, at a precautionary standard. And at the moment, that should be in clinical settings in particular, but also in settings where people are at high risk, including schools, education, care settings, public transport, and other cram spaces. We need to ensure that people can stay home sick with pay if they are ill with COVID, just as they do with other viruses, and not be subject to draconian absent policies. And vaccinations must be made available free of charge to those who want and need them. We need continual virus surveillance and intel to know what's happening. There needs to be transparency of data, and we need our occupational health services to provide a more coordinated and better occupational health response to keeping people in work, and our health services providing better treatments for long COVID health conditions. Finally, we need a health service and a care service that puts people's health and lives at its heart, and profiteering is taken out of them. I hope you have a brilliant conference. There are some fantastic speakers, and most of all, share your experiences, and together we can work collectively against COVID.